The Wellness Hour. An in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today is a hot topic, liposuction. What's new? In fact, new high-definition lipo allows the doctor to literally chisel out, in some cases, stomach muscles, etc. Well, today we have an expert on the topic. He's been doing liposuction for quite some time, Dr. Aguirre. Dr. Aguirre, welcome to the program.
Hello, thank you.
This is very interesting, and I've had you on the show talking about other things, but, you know, board certified in gynecology, working with women for many, many years, and you say that it goes together.
Sure.
Liposuction and what you're doing. Tell me a little bit about that.
Right. So as a urogynecologist, I see women with vaginal issues, pelvic floor issues as a result of pregnancy and deliveries.
Because you're a pelvic surgeon, right? I mean, that's what they...
Exactly. So as the changes that occur that I deal with and have dealt with for over 10 years, those body changes that occur with pregnancy, I also address. And that would be, you know, any excess fat on the abdomen or changes that occur with aging, not just necessarily pregnancy. So
you feel like it is your role?
It took a little while to understand my role in this, and it was clear after patients were very comfortable with the idea of asking me to do these procedures. So at first I didn't think so, but what patients commonly say is, if I'm going to trust you with my bladder and my bladder repair...
Because you do vaginal beautification and things like that.
Yeah, and so if patients trust me with their vaginal repairs and their bladder lifts, they have no hesitation in wanting me to do their liposuction.
So you have three things you focus on in your practice. What are they?
Yeah, so that's urogynecology, so it's the pelvic reconstruction, plus the cosmetic gynecology, doing labia reductions or vaginal tightening, plus the liposuction.
Okay, good.
So it's very common to see patients come in for a referral for incontinence, and then they realize that I do these other procedures. So I'd say 20% of my patients get some additional procedure in addition to their incontinence procedure. So they may have a labiaplasty, they may have vaginal tightening, and more now, these patients are wanting liposuction.
So what's changed in the world of lipo? I mean, why is it better now than it was, I guess, 10 years ago, 15 years ago?
Sure. So actually, the changes that have happened have allowed me to do this in my office. It allowed me as a pelvic surgeon to do it in my office. So traditionally, what most people think of liposuction as a very aggressive, painful procedure done under general anesthesia. With the changes that have happened with liposuction, I'm now able to do them myself in my office, mainly because of being able to do it awake. And so there's the form of anesthesia.
So the patients are awake?
Patients are awake. So what we use is a tumescent anesthesia. We calculate a certain amount of anesthesia that we can safely use in the office. And we infiltrate that underneath the skin to make them completely numb.
Okay.
And with them awake, the advantage is that so with them awake, it's actually a safer procedure, because at the moment I'm in an area that I shouldn't be, the patient will tell you with some discomfort that, you know, that area is not numb. So
do you think when doing it awake, you're more precise? And are you able to move the patient?
Sure. So sometimes towards the end of the procedure, we're actually able to ask the patient to either stand up or move and change position in a certain way, so that we can fine-tune the areas that we're trying to that we're trying to get to. With the tumescent anesthesia, what it allows is for almost a bloodless procedure. So it's a very safe procedure with very little bleeding. And it allows us to use our special technologies. So what else has changed in addition to the anesthetic option, or the local anesthesia option, is our lasers. So in my office...
So is that what this Smart Lipo that you use is? It's a laser liposuction?
Yeah. So it's Smart Lipo, which is the first laser that came out in the market about 3.5 years ago. And so that's the technology I use.
Well, how does it work? So tell me about that.
Yeah. So because of the laser, you're able to use a very, very small probes that go on through the skin through very small incisions. And then you're able to liquefy the fat and get rid of the fat and destroy the fat that our objective is, that we're trying to destroy.
So at the top of the show, you know, I said that liposuction is still the #1 cosmetic procedure. That it's becoming more and more mainstream. Are the patients getting younger and younger? older and older coming in for lipo?
Sure, it's a very popular procedure. In my patients, we've seen them in their early 20s to their 70s. And I think part of what makes it so popular is because we're not having to take them into an operating room or in a hospital. The cost is lower, and we're able to address areas very safely. So as far as in my practice, the most popular areas to address is the abdomen to also the thighs. And then you may ask me, well, why am I doing this as a pelvic surgeon? The first area of interest that I had was in doing the pubic mons and making that lower area where the pubic hair is smaller.
So as a gynecologist, women would come to you for pelvic surgery, and they would ask you about that area.
That's what led me to look into this, because they were coming into me for their pelvic concerns, and they were pointing in an area that had excess fat, and the only way to remove that is with liposuction.
Okay, and you were sending those people out.
Right, and then with the advantage of the new technologies, the laser and the local anesthesia, we can do it safely in the office. It's just as easy, and it's just common sense that the next step would be to also do the liposuction of the abdomen or of the thighs or other areas that
How often do you do lipo? I mean, how popular is it in your practice? You do it every week?
Every week. So
Are you better? Are you getting better and better? Is it one of those things that you get better and better?
You do, and you can't stop getting better. I think it's just like with whether it's my pelvic surgery training or the aesthetic vaginal surgery training, I always like to visit them and see how they're doing that. And so for a perfect example of that is I just recently finished some high definition liposculpturing training, which really I think which will definitely take high definition liposuction. And so just recently I've finished getting additional training in new techniques in liposuction, and it's really taken my skills to a new level.
I said you could chisel out like ab muscles.
Sure. Well,
is that an exaggeration? I mean, on the right patient?
Well, what it is making the appearance of someone being very, very fit.
Okay.
In the majority of my patients that we're doing liposuction on, they're pretty fit already. And what they're looking for is, that they don't want just a flat tummy. They want a tummy that looks healthy and looks athletic. And that's the idea in adding the high definition liposuction, is to make the results look more natural.
Now, why do you like lipo, by the way? I got to tell you something. Our program airs in 36 states and all over Canada. And I try to get guys to come on the program and talk about lipo. And these guys, and the public needs to know this, that behind the scenes, they go, Randy, I don't want to be stuck doing lipo all day. I don't like lipo. It's very tedious. Why do you like it?
Well, what I like about it is that it brings out the artistic side of me. And I think just whether it's doing something cosmetic in the pelvic area, but you can also do that with liposuction. And I think the other benefit of it is just the patients really love the results. And so it's one of the most,
happy group of patients.
Oh, it's one of the most gratifying things I do. So whether it's the abdominal liposuction, or if you have a young woman who's always had saddlebags, and then you just with the procedure that lasts less than 2 hours and an easy recovery, and then for them to come back and just be smiling about their new figure and how they may look better in jeans or in their clothes, that to me is very rewarding.
It's very interesting. On the telephone we talked about this. You said, Randy, it's not about liposuction, it's about self-esteem.
Right.
Elaborate on that.
Yeah. So everything I do is about self-esteem, and it's a quality of life procedure. It brings they're able to enjoy life better. They're able to be more conscientious about how they eat and how they exercise. They take care of themselves better.
Is that right? So after the procedure, this works like a kind of a kickstart or jump start?
That's a great way of saying it. I've seen a number of patients, they end up, liposuction isn't for weight loss, but what I very commonly see is patients come in and they say, Doc, I weigh 15 pounds less than I did 6 weeks ago. I mean, they become a lot more conscientious about what they're eating and what they're just taking care of themselves.
So there are certain people, by the way, that maybe run 10, 15 miles a week, or they're in Colorado hiking like crazy, 7-hour hikes, 8-hour, and they still can't get rid of a certain area.
Yeah.
I mean, is that ideally who it's for? Somebody in good shape, they've got this crazy area.
And I think that's why I think we're so popular in Denver with that, because the Denver is the healthiest city in the United States. They're the thinnest, more so than in California, than here in San Diego.
Okay. And did the local paper say that, by the way? Is that a real statistic? So, by the way, I've been to Denver, and everybody is in fantastic shape. Yeah. Everybody looks good there.
And so, you asked earlier, well, what is the typical patient? It's a very athletic, not necessarily young. It'll be an athletic patient, an athletic person who's been working out and there are certain areas that they just can't get rid of, and that's who liposuction is ideal for. But I also do liposuction in women who are a little heavier, and so
the heavier patient as well.
Sure, an excellent area would be like say below the neck.
Okay, so let's start with the neck, and we're going to go through. I guess we're on abdomen. You do the bra strap area,
sure,
the legs. But how well does the neck treat?
It's great. I mean, the neck, if you think about it, is the first thing people look at because it's part of the face.
Okay.
And so it's really what they're very self-conscious about. They may be self-conscious about the abdomen or their thighs, but if it's the first thing that everybody sees, it's really what's a wonderful area to treat.
Okay.
So these patients come in very, very
Is
happy.
it men and women, more men than women, or women than men?
It's 50-50.
Okay.
Having the type of practice that I have, most of my patients are women. I have patients bring in their husbands or their boyfriends to do either a neck lipo is a very popular one amongst their spouses.
Okay.
Now, the laser, what's great about using the laser in the neck is there really isn't like a ton of fat there in most people.
Okay.
It's just the loosening of the skin. So the volume that we remove is really a small volume. It's very common to remove only 100 or 150 cc's of fat from that area. But the result is with the laser we can really treat the skin, heat it up, and create a tightening effect. I think in some patients it takes 5-10 years off their life.
So they look younger because you took care of their neck.
They can. I mean, I have patients come in and they bring in a photo that somebody took of them, and they point out that they think it makes them look older, and either older or fat. But it's really neither. It's just the tightening effect of the laser on that skin really takes years off.
And you say that people will see a photo of themselves from a side view, and they go, "I got to go in there."
Yeah.
Is that right? I mean, they tell you that?
Oh, it's very motivating when they see that.
So how long does it take you to do it?
It takes less than an hour, and in some patients we can do it in 30 minutes. And then the nice thing also is their downtime. They're back to work the next week.
So coming on a Monday, I mean, ideally, and be back.
Ideally, they could, if they take a week off. It's very easy. Some people who have to go back to work, they can if they don't mind wearing a garment for the time at work.
Okay.
But typically they'll wear a garment for 72 hours, and then they can go to work and just wear the garment at night.
All right.
So it's very, very easy to recover from.
What is the number one procedure, by the way, on the body? The number one area
for liposuction that I do is definitely the abdomen.
The abdomen. Okay. Yeah. So after pregnancy, I mean, and what are the ages of the patients, by the way?
Well, the abdomen, the patients have been anywhere from 25 to 75.
75-year-olds are coming in for liposuction.
I mean, I have a patient who actually came in referred for her incontinence, and she was 64 years old. And decided to wait to get her incontinence treated so Medicare could pay for it, but she wanted to pay cash but she was willing to just pay out of pocket for her liposuction, because to her the value, I think, is bigger to have her abdomen look better than for her to still be leaking.
Are there triggers that, I mean, the patients tell you that get them to do or want to do lipo?
I mean, for my practice, the triggers would be that they're about to have surgery for some other condition that they're seeing me for. And so
right now, most of your patients are people that are coming to you for their gynecology part of this.
Most of them, at least half.
All right.
At least half of the patients are getting ready to have a procedure to fix their incontinence, for example.
Interesting. Okay.
So they need to recover for 4 to 6 weeks, depending on the procedure that they're having. So the week before their pelvic surgery, they come in and they do liposuction.
Okay.
So it's a wonderful thing to be able to offer them something in the office the week before they have a vaginal procedure to fix either something cosmetic or something functional like incontinence. So in essence, they're getting many things taken care of all during one recovery.
Okay, we're going to take a quick break. We come back. Other parts of the body that you're doing, what you're doing for the legs, what you're doing for the back, and love handles, and men after that.
Great.
You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. We're talking about new breakthroughs in liposuction, from laser liposuction with Smart Lipo to high definition lipo. We'll be right back. You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, liposuction, what you need to know, new breakthroughs. Okay, so the laser technology is really what's new, and that's hot. Is that right? I mean, you're able to remove more fat, break down the fat, and then suck it out.
Right.
Is that right? Okay.
And there's there's several technologies that we can use, and I happen to have Smart Lipo, which is a laser. But depending on the patient, some patients have larger volumes that we have to remove. So I can either use my Smart Lipo, or I also have another technology called Vaser.
Okay.
Both technologies are excellent.
Vaser, tell me about that.
So Vaser is an ultrasound type technology, and instead of melting the fat like a laser does, what it does is it vibrates at a very fast speed and it liquefies the fat. So the idea behind both of them is to make it easier, is to destroy the big fat globules, if you think about it, and be able to remove it with just smaller cannulas. So with both techniques, we can do them both in the office.
Does it give smoother results?
Absolutely. So what the big concern with patients, the most common concern with patients is, am I going to have lumps or bumps? Is it going to be uneven? And that's the benefit of using these great technologies, where we can very carefully get to the areas of fat that we want to and destroy specific areas without creating these lumpy areas. And so if we, by using the laser or the Vaser, we can destroy the fat, and then we gently remove the fat with small cannulas.
Okay, and this is done without general anesthesia.
Absolutely.
Is that correct?
Yeah, yeah. And that's what people do.
So it's safer because of that, obviously?
Yeah. There are risks with general anesthesia, right? So there could be, there's a high risk of blood clots. If you're under general anesthesia, it's probably going to be a longer procedure. So there's more risks the longer you are under anesthesia. This is similar to, you can go into the office and you just go home that same day without the risk of anesthesia. So
okay.
There is a huge risk.
Now, I interviewed the inventor of tumescent liposuction, was on this show, and he said, Randy, doing it awake allows you sometimes to move the patients. You get better results. It makes you more precise because you can't poke the skin.
Right.
Things like that. So there's lower downtime possibly doing it the way you're doing it. I mean, I'm not trying to endorse you. I'm saying, but is that true? I mean, do you feel the same way?
Oh, absolutely. So it is such little downtime that a lot of the patients that I operate on, within the next week, they're doing another procedure to fix prolapse or incontinence. So they undergo 2 procedures during the course of a week and recover during the same time. So the idea behind the tumescent anesthesia and the beauty of it is being able to do these procedures in the office with less risk and with greater recovery.
Now, you refer to this as the real mommy makeover.
That's right.
As
opposed to the mommy makeover. So the real mommy makeover, meaning that with my expertise in the pelvic surgery, we're also addressing vaginal concerns, which is really what is the sequela or the problems that occur after vaginal deliveries. So we're taking a very common problem that happens to women that is very sensitive and difficult to talk to, and that same patient also has these other concerns with fat distribution, whether it's in the tummy or in the thighs. Just last week, I operated on a patient that we did liposuction of her thighs the week before, and the following week we did vaginal reconstruction and vaginal beautification. So to me, that's
a real mommy makeover.
That's the real mommy makeover.
Very interesting, very interesting. So it is common that these people, and you do it always at separate times?
I do, yes.
Okay.
And the reason is because when we bring in the liposuction to the OR, there would be higher fees for the patient. So it ends up being more economical for her.
So you do both procedures right out of the office?
Yes.
So it's a lower cost?
It's a lower cost. So the results, I think, are tremendous. These patients come in, like the other day I was operating on a patient, I was doing her liposuction, and I asked her, so what made you want me to do your liposuction? And she said, well, you operated on my bladder a year ago. I trust you more than anyone. And so there she is.
So can they find you in the local papers? I mean, some people are looking at you. They find you on your website that they know, because you're a pelvic surgeon.
Right. So
but you've been doing lipo for quite some time.
Yes. So patients find me either through being referred to me because of their bladder issues or on the internet.
Okay. I'm sorry, I interrupted you. Okay, so the woman said that she went to you a year earlier.
Yes. So, we were having this conversation as I was doing her liposuction. So she's fully awake. And it just dawned on me to kind of ask her more. Well, why, ask her what made her comfortable, or because the topic had come up that day is well, why is a pelvic surgeon doing liposuction?
Yeah, that's a good question.
And she gave me the answer. It was, well, I trust you with my bladder, and of course I gave her. She was happy with her results with her vaginal surgery, and she was very comfortable with me doing her liposuction. And so I asked the next question. So, do you think someone like myself should be doing that? And she had no concerns at all.
So you should be doing this.
I absolutely think I should be, and not that I want to be defensive about it.
But the main thing is results. I mean, the main thing, women want to look better, men want to look better, and they want to go to somebody that could do it right and do it right the first time. So you have the newer technology. We're talking about high definition lipo. You take special training for this.
Right, absolutely.
You've got this Vaser, which is ultrasound. Is that right?
Ultrasound.
Sound that breaks up the and removing.
It's wonderful.
And that's for bigger, heavier people. Is that correct? Do I understand that right?
It is my tool if I have to remove larger areas of fat, but I also use it in smaller areas. But the point is, depending on some patients come in and I use both technologies. So I can use the Vaser and the Smart Lipo all
Which
in the
is
same
the laser
patient,
lipo.
Which is the laser lipo.
Okay.
So if I have a patient and she wants her medial thighs done, but she also wants her tummy done, then I have both technologies to do, which is, I think it's a big advantage for me to do it because I can address, I can use the tool that I want.
So do you go all the way around when you're doing the abdomen? Do you go to the all around the patient?
Absolutely, because patients when they come in, it's not just the abdomen; they also need some fat removed from maybe their muffin tops and their flanks and their back, and so. In the office, we're able to do it very safely, but in some patients we may have to break it up because they may be larger patients. So in one sitting, we may do the abdomen and the muffin top, and then the very next day we're able to do the back. And so in essence, and those are fun procedures because in essence we're able to really sculpt the patient and the results are amazing.
So the back area though, around the bra is, it's a good area to treat?
Oh, it's a great area.
It's popular?
Well, if you think about it, women who are bothered by their bra fat, what's on the top of their mind is that everybody notices it. And so it really affects what they're wearing. That they may, or another area, whether it's the bra fat or whether it's the arms, it really changes what they're comfortable in as far as clothing. So, and to be able to address areas like that and make these women more comfortable with what they're wearing and just in a day-to-day thing on their day-to-day living.
So arms treat well.
Arms are, some patients are such a nuisance for some patients. I mean, you'll see women who do not want to wear short sleeves because of it. And so being able to treat the arms, it really it improves their quality of life because now they come in with being more confident with themselves and with their clothes, especially during the summer months and preparing for summer. It's a very popular time to do the arms would be in the springtime.
So if somebody's going to go on a vacation, how much time should they plan for their liposuction before they're going to Cancun or wherever, Hawaii?
That's a great question.
I mean, do they do that?
We get asked that all the time. And actually, what one has to plan for, it depends on the area that we're treating and how much volume we have to remove. Because, I think a big misunderstanding is that you can have lipo and just be completely healed by the next week. It depends on the area.
But you can work the next day.
You can work the next day. You can function and be yourself. But the healing takes some time, and it depends on the area that we're treating. So if it's a large area, let's say if it's a big abdomen and it's a large area that we're treating, realistically, she's not going to want to. She's not going to be fully healed for a few weeks. And so as far as the planning goes, 3 to 4 weeks before a vacation is the best time to do the procedure.
Okay, and we're out of time, but the legs. We haven't talked about the legs.
Sure. So the legs are one of my favorite parts to do because it's either the lateral thigh or medial thigh. And for example, I have a patient who forever had asymmetry. She had one saddlebag that was much larger than the other. And when we treated both areas and gave her symmetric legs, she's definitely one of our happiest patients. And so it is a fun area to treat because it empowers these patients and it's all the quality of life that they have.
And the fat doesn't come back.
That area, the fat does not come back.
And not all doctors. We the wellness hour, and people need to know this is a real interview. I'm not endorsing you by interviewing you, but not all doctors are using laser liposuction or the high definition, as you call it, liposuction, which is ultrasound, or do I have it mixed up? No. One is laser, one is kind of...
So the high definition liposuction is the techniques on how to sculpt how to give that sculpted look.
Oh, okay. Okay, that's more of a technique.
Yeah, and one can use either the Smart Lipo tool, or a laser tool, or a Vaser as your tool.
Okay.
Yeah. So, but the advantage, I think, in my office is being able to use both, and then doing it awake as well.
So knees, are there any areas that we haven't talked about? I mean, do you ever do knees or?
Well, we talked about a number of areas, but we haven't covered the knees yet. We can do the knees, the pubic mons, really from top down.
So your friends that see this and say, "Oh my goodness, he's a pelvic surgeon, he's doing lipo," but you're saying your patients have been asking you to do this for years.
Oh, since I started my practice. So I feel I'm just responding positively to what my patients are asking on a weekly basis.
You're good at it?
I'm very good at it.
Would you put your results against anybody else's?
I would love that.
Okay, good.
Yeah.
Good. Well, I want to thank you for coming on the show. Very interesting. Right. Good stuff.
Thank you very much.
Good stuff. And more information about your liposuction can be found on your website as well?
Absolutely.
And your patients, I bet, are going to watch this, because this happens. They're going to watch this and say, "I didn't know he did liposuction. You did their bladder surgery or whatever." What do you say to them? What do you say to any woman unhappy with a part of their body, but maybe they're afraid of the liposuction?
Well, there's solutions. You can come to my website and look at the before and after photos, and see the before and after photos of all the areas that I treat.
Okay.
But for sure, the liposuction is a perfect fit with the patients that I'm seeing.
All right. Well, thank you for coming on.
Right. Thank you very much.
Stuff. You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again online, you can visit our website at wellnesshour.com. Just put in Dr. Aguirre. If you can't spell Dr. Aguirre, just put in liposuction or liposuction Colorado, and you'll find him there. For now, I wish you could help.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.